My name is Cassie Kleppel. I am a 4th semester nursing student. Today's April 16th and it is 11:30. I'm doing my insertion of NG tube video, and before going in to start it, I would make sure they haven't had any previous nasal surgery, deviated septum, gag reflex. I would check their nares, and then I'd make sure I have an order, and then I would begin. Hi, Mr. Jones. My name is Cassie. I want to be your student nurse today. Can you tell me your name and date of birth? Awesome. We're going to be putting an NG tube in today, and then I would explain the procedure to my patient and provide privacy. I would raise the bed and then put them in high Fowler's position. Put a towel over them in case there was any mess. And then I would measure my tubing from the tip of the nose to the earlobe, and then from the earlobe to the xiphoid process, which is about 45, and then I would put a piece of tape there. Mark it on the 45. And then also make some tape for later. I'd have the patient towards me. And then I would first want them to hyperextend their neck, so the pillow under them. And then I would check which nostril I'd want to use. I'd hold one of them and tell them to breathe out, and check the other one to see which one I want to put it in. And then I would put this tight and then release it to make it easier to put in, and lubricate up to 4 inches. Once I was ready, I tell my patient to take a deep breath and then insert it. Once I see it in the back of the throat, then I can have them lean forward, and I would have them have a water, and as I'm inserting, I would have them take a sip and then insert it to my marked area. If you're meeting resistance, then you could take it out, add more lube, and go try the other nostril, or if they started coughing and were in distress, then you would remove the tube completely. For this purpose, the mannequins won't go all the way in, but you would go to your tape, but I'm going to leave it there. Once it's inserted, then you will put a temporary piece of tape on to hold it in place. And then once you have it temporarily, you can test to where it's at. You can look in to make sure that it's not coiled up in the back of their throat. You can test, get some residual out, test the pH on pH paper, or I can insert air into this and then listen over the epigastric for air bubbles. Or lastly, you can get an x-ray to check the placement. And once it's you check to where it's at, that's when you would tape it securely on them. Once you have it secured, then you can either hook it up to suction or clamp it, whatever the order says, or to a feeding. And then you also want to secure it to their gown with the safety pin. And then you would get your patient comfortable, lower the bed, give them their call light. And then you would assess or document how the procedure went, what type of tube you used. If there was any output, you would document that and how the patient tolerated.